The clinical evaluation of language fundamentals preschool 2, also known as the CELF P2, is a standardized test that assesses language skills in preschool-age children. The purposes of the CELF P2 is to assess language skills and identify language deficits in children ages 3 to 6 years old. The CELF P2 contains 9 subtests which evaluate the many skill areas involved in a child's expressive and receptive language. Utilizing only 3 subtests, sentence structure, word structure, and expressive vocabulary, a diagnostician may calculate a child's core language score, which detects the presence and absence of a language disorder in a time-efficient manner. Once a language disorder is indicated as present, the CELF P2 can then evaluate the nature of the disorder, early classroom and literacy fundamentals, and communication in context. Overall, the CELF P2 provides a flexible, multi-perspective assessment that determines a child's language and communication strengths and weaknesses, aiding a diagnostician in making relevant recommendations for intervention and accommodations.
The test package includes Examiner's Manual, Stimulus Books 1 and 2, Record Form, Concepts and Following Directions Stimulus Sheet, Pre-Literacy Scale, and Descriptive Pragmatics Profile. The Examiner's Manual provides detailed information on the validity, reliability, and normative data for the test. Detailed instructions are also included on how to score each of the subtests. The examiner is provided with specific guidelines for interpreting the child's score and evaluating his or her performance. Stimulus Book 1 contains the instructions and visual stimuli for each subtest. Stimulus Book 2 contains visual stimuli that is presented to the child during the recalling sentences in context subtest. The record form is used to score each of the subtests. The Concepts and Following Directions stimulus sheet provides a script for the Concepts and Following Directions subtest. The Pre-Literacy Scale and Descriptive Pragmatics Profile are each in checklist format and may be filled out by either the child's teacher, parent, or clinician. Alex Smith is a 4-year-old male who was diagnosed with a mild form of spastic cerebral palsy, which is a non-progressive neurological disorder caused by damage to the developing brain before, during, or immediately after birth. Common symptoms of spastic cerebral palsy include hypertonia, gait disturbances, expressive and receptive language delays. Alex lives with his parents and older sister, where English is the primary language. He attends the preschool program 5 days a week for 3 hours per day. Alex enjoys watching movies and playing with the family dog. Alex presents with the following symptoms: using 1 or 2 word utterances to communicate, reduced intelligibility, omission of plurals and verb endings, delayed development of present progressives, difficulty following 1- and 2-step directions. When conducting the CELF P2, the clinician should expect Alex to present with difficulties in both areas of receptive and expressive language similar to those previously mentioned. The CELF P2 is unique in that it provides the child with first a demonstration of each task and then 2 trials so they have an opportunity to be familiarized with each subtest. In addition, the CELF P2 has what is referred to as the discontinue rule. This enables the examiner to discontinue a subtest if the child receives a specific number of consecutive 0 scores. This allows for a more time-efficient test administration for both the examiner and the child.
These pictures. I'm going to point to the picture that shows I can eat this. Point to the picture that shows it smells good. Let's try some more. Look at these. Point to the boy has a ball. Let me show you some pictures and say some things about them. I want you to help me by finishing some of the things I say. Let's try one. Here is a boy, and here is a girl. Let's try another. Finish what I say. This boy is standing. This boy is sit. This boy is standing. This boy is
sit,
I want you to say sitting to finish what I say. This girl has 2 cats. This girl has 2
dog,
This girl has 2 cats. This girl has 2
dog,
Look at this picture. This is a bird. Look at this picture. What is this?
sock,
Now look at the picture on this page. What is she doing?
baby cry,
What is she doing?
baby cry,
Now let's look at some more pictures. I will point to each picture and then you tell me what you see or what is happening in the picture. Let's start. What is the girl doing?
ride,
These animals. Point to the cat. Now I'm going to show you some more pictures. This time I will say go when I want you to point. Do not point until I say go. Ready? Point to the dog, go. Okay. Now look at these pictures. There are big animals and little animals. Point to the little cat, go. Now I am going to show you another picture. Point to the dog and then point to the monkey. Go.
dog,
Okay. Let's try again. Point to the dog and then point to the monkey. Go. Okay. Okay. I'm going to say something to you. I want you to listen carefully and say exactly what I say. Let's try one. Say, the dog is eating his food.
dog, eat, food,
Okay. Let's try again. The dog is eating his food.
the dog, eat, food,
Let's try another. Remember to listen carefully and say exactly what I say. What is in the box?
box,
Okay, let's try again. Remember to say exactly what I say. What is in the box?
box,
Let's try some more. Remember to listen carefully and say exactly what I say. Look at these children. This is a baby. The baby is little. This is a girl. She is little too. And this is a boy. The boy is big. Look at the children again. Point to the one who is big. Good. Look at these pictures. Point to the one who is sad. Say some words and show you some pictures. 2 of the words go together. Look and listen as I say the words. Bread, shoe, and apple. Bread and apple are the 2 words that go together best. Bread and apple go together because they are things you can eat. They are both types of food. 2 of these words go together. Look and listen carefully to the words I say. Tell me the 2 words that go together. Cat, lamp, and dog.
cat, dog,
How do the words cat and dog go together?
and
Cat and dogs go together because they are both animals. Now let's do some more. We're going to read a story together. No juice. Mom and the children were getting ready for lunch. Mom and Amy were making sandwiches and salad. Mark was setting the table, and Billy was looking for mustard and apple juice. Billy looked in the refrigerator. No mustard, no juice, he said. I can't find them. What did Billy say?
Can't find.
Billy said, I can't find them. Mom decided that they needed to go to the grocery store. Everyone got in the car. Mom said, put on your seatbelts. What did Mom say?
Seatbelt on.
Mom said, put on your seatbelts. They drove to the grocery store and got a shopping cart. Mom asked Mark, will you push? What did Mom ask?
Will you push?
I'm going to say 2 words. Listen. Pan, cake. I can put these 2 words together to make the word pancake. Now you try it. Put these words together. Rain, bow.
Rainbow.
Put these words together to make 1 word. Bed, room.
Bed.
Inside.
Inside.
The record form for the CELF P2 is 12 pages consisting of separate sections for each subtest. Each subtest has their own guidelines for scoring. For the scoring of this specific subtest on sentence structure, the clinician circles the letter corresponding to the child's response and then circles 1 for a correct response and a 0 for an incorrect response. The clinician then adds up the raw score.
After all the raw scores are calculated, the examiner enters the raw score data onto the chart on page 2. From there, the examiner refers to the examiner's manual for specific instructions on how to calculate the additional scores and interpret the child's performance.